Okay, everyone, I make that 2 minutes past 3, so we will get going. Hi to everyone who's saying hello in the chat with where you're from. It's good to have you all here. So good afternoon, everyone, and welcome to our 6th webinar on the Test and Learn Systems-Wide Evaluation Programme, which the Centre for Homelessness Impact will be running on behalf of the Department of Levelling Up Housing and Communities over the next 3 years. This webinar is going to focus on using data and council data to prevent homelessness. And we'll paste the link to the one remaining webinar on our Outreach Health project in the chat as we move through the slides today. All of the webinars are being recorded, and they'll end up on our website, which is homelessnessimpact.org/test-and-learn. And then so you can rewatch them there if you've missed one, or indeed the program overview. So my name is Graham Garner, and I'm the head of programs at the Centre, responsible for delivering on this project alongside our many partners and the team here. We don't have full time to do 4 round of introductions, so I'm going to quickly introduce the team working on this project, and you'll have the opportunity to hear more from them soon. So I'm going to start with Ella Whelan, who's our program lead on this project and will be the key point of contact going forward. From our evidence and data team, we're joined by Abby Kendrick, who's our evidence lead, and she'll be working with the evaluators on this project. And then we're delighted to be joined by Tom from Zantura, and I think Sarah will be joining us from London, the London Borough of Barking and Dagenham, who will both be helping deliver this project and hopefully working with some of you in the future. And we're going to talk about their roles a bit later on. And not to forget Kailis, who's online and helping us with all the tech today. And we'll be posting important information into the chat as we go along. Thank you. So, and welcome to Sarah, sorry, who's coming in from LBBD and has just joined us. So now you've met the team, I'll start with a bit of virtual housekeeping. We are recording the whole session today to put the webinar on the website in the coming days. There's a Q&A function that you see in Zoom. So we're going to create your questions and then I'll ask them to the panel at the end of the presentation. And we're also going to use these to populate an FAQ, which will be held on our website. Will be uploaded within the next week. So who are CHI and why are we here? As many of you will know, the Centre was founded with a mission to act as a catalyst for evidence-led change to enable people working in and around homelessness to achieve breakthrough results. Our goal as an organisation is to ensure that the policies and projects to tackle homelessness are as effective as possible and that we gather as much evidence as we can on what works and use that evidence to improve outcomes and create impact. So aware that someone's putting their hand up. If you put it in the Q&A, we'll be able to get your question there. Sorry. I can't see any questions at the moment, so we'll carry on. So that's why the Centre was delighted when DLUHC announced as part of the 2022 Ending Rough Sleeping for Good strategy that they were going to invest £15 million to improve the evidence base and understanding of what works to end rough sleeping. This ambitious commitment gives us the chance to prove what works and make the case for future investment in these types of services. Following a competitive process in the autumn of last year, CHI were awarded the contract to deliver on that commitment on behalf of DLUHC, and that's why we're all here today. In this webinar, we're going to be talking to you about one of the 8 exciting test and learn projects, which will be formally and robustly evaluated to improve the evidence we have of what works to end homelessness and rough sleeping. We're also going to be outlining the plans for the systems-wide evaluation focused on homelessness and rough sleeping. And you can find that on our website in the link I referred to earlier on. And that's going to look at the wider factors that drive homelessness and what works well or indeed less well within the current system. So I'm going to move on to Test and Learn programme now and talk to you about some of the key principles and reason why it's so important. The projects were chosen from a list of over 100 that we in the wider sector thought it was important to test. Each one will be evaluated to see if outcomes for people in receipt of the support improve and also how it was implemented and whether it is value for money. Most of that £50 million will be spent on the projects delivering services to people experiencing or at risk of rough sleeping and homelessness. We know that some of the projects already exist in England, which is why they've been designed to support people like you to make the case for successful interventions continuing or bringing these new interventions to your areas in the future. So you've heard me mention at the start that this is a 3-year programme. This is an overview of how the next couple of years will work, we move forward. So we've done a lot of prep work over the last couple of months with organisations like Zantura here today. We're going into the launch phase at the moment where we're going to be opening the grant making from the 2nd of April through into mid-May. We'll then be working with organisations like yourselves on the delivery of services and getting some initial reporting about what works and disseminating that to the wider sector. And then the whole programme will come to an end towards December 26, where we will produce final reports on the each test and learn project, why it's worked, what's worked well, and our recommendations for the next steps. So that's the background to the 8 projects, which are now up on the screen. Today's focus will be using council data to prevent homelessness. So I'm going to hand over to Ella, Abby, Tom, and Sarah to talk you through this in detail.
Thanks, Graham. So some of the key things that you need to know are on this slide. So we will be asking for expressions of interest from interested parties to deliver this exciting new service, as well as bids to evaluate the new service. And we're looking for 4 local authorities to work with us at the centre, with Centura and the London Borough of Barking and Dagenham, and the appointed evaluator on this project. So shortly I'm going to pass over to Tom to tell you about the work that Centura do and their data platform OneView. The evaluator that I mentioned, and as Graham mentioned earlier, will be conducting an RCT evaluation, which Abby's going to tell you a bit more about. And then the key dates that you need to know are the 15th of April, when the expressions of interest applications will be open on FlexiGrant, which I'll tell you a little bit more about later. And then we're expecting that setup phase to last sort of from July to November, and then the delivery phase to last from November to January 26. But they're kind of approximate dates. Go to the next slide, please. So some of the key features of this project. So we'll be using data to identify people at risk of homelessness. The project is focused on people who are identified as at risk of homelessness by that OneView predictive model. So you'll work closely with Tom and his team at Centura to deliver this. And the OneView platform will use your existing data to identify a list of residents who are at risk of homelessness, and a team of existing council staff will then make a simple phone call to signpost to services and offer appropriate support. So we're looking for about 4 local authorities to deliver this service, and we would expect approximately 500 people to be supported per authority, although we won't expect that 500 phone calls are completed, as not everyone's going to pick up the phone. So now I'm going to pass on to Tom to tell you more about their wonderful and exciting work.
Brilliant. Thanks very much, Ella. Hi, everyone. Thanks very much for joining the call and for your interest in this work stream. I just wanted to open up by giving a little bit of background about Centura, just for anyone who hasn't heard of us before. So we were founded over 10 years ago with the ambition of improving outcomes for vulnerable people through the better use of data and analytics. And over the course of the last 10 years, we've invested a significant amount of time evolving our OneView platform, but also working across a range of different areas within local authorities and the wider public sector. So I just wanted to touch briefly on some of those areas before we kind of dive into the platform and homelessness more specifically. So we're currently working with councils looking at community safety and serious violence. So we're working with some of the VRUs to build out a range of different dashboards using multi-agency data, but also look at identifiable data to try and prevent youth violence. We're doing a range of work in housing and homelessness, which we'll come on to talk about in a little while, and which is the focus of obviously this specific test and learn program. We're also doing a lot of work in adult social care, specifically looking at things like pre-frailty and falls prevention, and also identifying individuals at risk of carer breakdown to enable early support and intervention. We're looking at the Supporting Families programme with a number of councils, and also looking at children at risk of escalation through the system. And we're also doing a lot of work around debt and the links between debt and vulnerability. So how you can identify people early who are at risk of worsening vulnerabilities due to escalating debt. And all of those agendas we're delivering from the OneView platform. And for some of our clients like Barking and Dagenham, who are joining us on this program, we're delivering across multiple different agendas with them at the same time. I guess a key underpinning belief for us is the ability to use multi-agency data to identify people early and therefore to prevent problems before they escalate and before they come too late. And all of our work is really predicated on evidencing the outcomes and being able to evaluate the difference that has been made through that early intervention and prevention for the residents, and also the benefits cases that accrue to the councils because of that. If I could move on to the next slide, that'd be great. So I just wanted to talk a little bit about the OneView infrastructure, which we're going to be using in this program of work. So we've been evolving this platform for the last 10 years. We've worked over the course of that time with over 50 councils. And I guess there are several points to make about the infrastructure and also the way that we operate. So the first one is that the ethics and information governance are really the starting point for us. So being able to ensure that we have the correct information governance in place to enable multi-agency data to be shared is critical, but then also ensuring that information governance is embedded at every step of the journey is also critical. So the platform ingests data from multiple different systems, but then it pseudonymizes that data, and we only use the fields that have been agreed through the DPIA, and those fields are only surfaced to individuals who have the right data sharing protocols. So it really is built around information governance to ensure that the data is dealt and governed in the appropriate ways. We're also, as I mentioned before, using the platform to work across a range of different agendas. So once established, what OneView does is to create a single view of a resident from data from across the council. So that could be adult social care, children's social care, debt, housing, police, health, community assets, various different organizations. And we have a unique matching engine which enables us to match data from all of those multiple different sources to create a single view of the resident. One of the other key areas as well is that we extract unstructured data as well as structured data. So a lot of the rich information about an individual and potentially their risks can be contained in unstructured data. And that's a really important part of the process for us because it enables us to deliver much more effective advanced analytics and predictive models. So once we've ingested all of that data, pseudonymized it and matched it, then we go through a process of building predictive models and other analytics. And then we surface cohorts of individuals to frontline staff to enable them to deliver interventions and support individuals who are at risk of certain outcomes. And we provide a case summary, which is an overview of that household, and also a case management system to enable the management of that process. So specific to this project, we will be looking to extract a range of data from councils around areas that are relevant to homelessness. We'll then be matching that data. We've already started to build and create predictive models to look at the different risks that are involved prior to an individual becoming homeless. And then we will be surfacing a cohort of individuals to the council to enable them to deliver a range of early interventions. So that's really kind of the key things that I wanted to draw out around the infrastructure and how it works. And I'm happy to answer any questions, obviously, towards the end. And then my final slide, if I may hit. Thank you. So in terms of the benefits for participating, obviously, we've done a lot of work in this space around advanced analytics, but it's a really great opportunity for participating councils to look at very early prevention for individuals at risk of homelessness. And obviously, the earlier you can get in terms of that intervention, the more options and opportunities are available to support that individual and the lower the cost of those interventions as well. There's also a great opportunity to work with a range of other innovative councils. So what we'll be looking to establish as soon as we kick off the project is a working group amongst the 4 councils, Barking and Dagenham, and Centre for Homelessness Impact and ourselves, so that we can look at things like the information governance, the different data that we'll be using. We can agree the different range of interventions, and we can use that as a way to really drive the agenda forward collectively. So that's a good opportunity to share best practice across those organisations. Obviously, in building out the homelessness work through the OneView platform, we'll be establishing an information governance-led approach to data insight and operational delivery. So as part of this programme of work, which is funded, we'll be delivering the homelessness agenda. But obviously beyond that, you will have an asset there that's available to potentially use for a range of other agendas in the future. We'll also be feeding back on data quality. So part of the ingestion process is that we provide a range of reports around data quality, and those will be available through the initial phases of the programme. And that can be a really good way to support the acceleration of data maturity within an organisation. Obviously, we've been working with councils for 10 years. So one of the common, I guess, challenges or concerns with councils is that their data quality might be too poor to initiate these kind of projects. Our experience is that in the way that we've set up the matching engine and the way that we extract unstructured data, we're able to work with the majority of councils and deliver meaningful output. But we can also feed back on that data quality and support them in that data maturity journey as well. And I guess the final point being that establishment of a single view at the centre of the council across the data, which can be a really good springboard moving forward. So I guess just to wrap up, we're hugely excited about this programme of work. We've done a lot of preparation around it, and we are working with a number of other councils on very similar agendas. So we know that we can deliver across it, and we're really looking forward to hopefully seeing lots of expressions of interest and working with 4 really innovative councils to deliver this over the next 12 to 18 months. So that was all I wanted to cover off in this session. I'll hand back to Ella.
Thanks so much, Tom. You explained it better than I ever could. So just to confirm, Zantura will be and Tom will be supporting.
I think that Ella has unfortunately frozen. If I can maybe get a nod from someone else to make. Yeah.
I've lost Ella.
Okay. Sorry about that, folks. So I'll try to fill the gap then. I can't really praise Ella, but here we go. So as Tom was saying, Zantura will be supporting with the implementation and delivery of the OneView platform. If you were successful through the expression of interest process, you work together with Tom and the team to set up that platform and deliver the service, including those phone calls, which are a key component of it. As noted, we're looking for partners who are future thinking, keen to use their data in innovative ways. We are looking for unitary councils for this project. I think that's due to the data that we believe that they hold to identify people at risk of homelessness. And we're also expecting you to engage and support IFF, which is a research organisation who will be doing data collection projects, and they're working across the Test and Learn programme. So we're looking for expressions of interest to be made through our FlexiGrant portal, which we're going to tell you more about a bit later on. Hopefully Ella's back. If not, I'll give it a go as well. And then this is a bit more, on this slide about what delivery would look like and what we need from local authorities interested in taking part. So caseworkers, and I think we can have a discussion about which team that would be within your organisation would make contact with people that are identified through the OneView platform and offer them support, including signposting to other services. We expect the partner to support the setup of OneView, generate those referrals and deliver the service. So we would really ask you to consider that before putting your application in. Are you set up to do that? Are you willing to do that? And obviously, you got to be ready to share any relevant data and support data collection and consent. So thinking about, Tom can maybe mention later on about your IT teams or your data protection officers. We're looking for organizations that are ready and willing to, go on this journey with us within the timeframes we've set out, and that's all due to where we want to get the evaluations done and then the reports back to the sector and DLUC around what works. So we're also recommending, obviously, that you have the full buy-in from your senior executives in the organisation. So I come from a local authority background, and I know sometimes to help the wheels move forward, it does help to have some sort of executive sign off or lead on the project, that if things get stuck, we can move forward. So with that, I'm going to now hand over to Abby, who will talk us through the evaluation process.
So the evaluation will have three components, and we've got the impact. So we're trying to measure the impact of the intervention. There's a process and implementation part of the project, and I'll talk a little bit about that shortly. And there's an economic part. So we're sort of trying to measure costs and benefits. Once we've got the impact, we can kind of do a cost benefit analysis of the intervention as well. And for this project, we are going to be evaluating the intervention by a randomized control trial, but we're relying on administrative data that's already collected by you folks in local authorities. And so essentially, the OneView platform will identify a bunch of folks who fall into the at-risk category. And what we'll be doing is basically splitting that number of folks into two groups. One will get the intervention, and the other half will just receive business as usual, so they won't get the intervention. But we'll follow those two groups over time and try and ascertain if there are any differences between the two groups. And in terms of outcomes that we're interested in measuring, the first one is going to be housing outcomes. So really, we're focusing on homelessness, but we're also interested in looking at those intermediary variables as well. So kind of as Tom mentioned, levels of debt and the types of things that are likely to ultimately impact whether someone might end up homelessness or not. So yeah, we're sort of looking at a number of variables and outcomes in the project. And just to sort of highlight here as well that the randomization aspect is super important. So the intervention itself is relatively light touch, but we to make sure that we are getting the most robust evidence that we can on the effectiveness of this intervention, we need to sort of adhere to the randomized groups very, very strictly. So we'll only be giving local authorities the list of folks who are in that test group, in the treatment group. And just to reiterate, this is a really important point about the working group. So the intervention itself is a one-off phone call, and the contents of that phone call and the contents of the type of support that's going to be offered to participants will be structured, because we all partners across the different local authorities will have to be delivering the same sort of intervention so that we can measure. We know what we're measuring, basically. We know what the intervention is, but we are by no means sort of imposing a structure on you. And part of the intervention, the nature of it and the ins and outs and the finer details of it will be fleshed out by that working group. So unlike lots of other interventions where we have it nicely set up, this is sort of a co-created intervention, but essentially you'll be kind of helped and guided by CHI, Xantura, and the other local authorities working on the project. So we'll be co-creating the intervention and what that looks like in practice. But essentially, the other requirements for the intervention, we need to be able to collaborate across internal teams. So there's going to be lots of different data from lots of different sources. So sort of a willingness and ability to do that is going to be required. And again, I've put caseworkers here, but it's really caseworkers in inverted commas as a placeholder, because we can kind of talk through, as part of that working group, who is the most sensible team to actually deliver the intervention in each organisation. But essentially, we need to have caseworkers loosely defined, willing and able to contact the identified participants. And we're thinking this will be around a 20-minute phone call. But again, this is sort of to be determined by the working group. And just to talk a little bit more about the process and implementation part of the project, not only are we interested in actually looking at the impact of the intervention, but we're also interested in learning about how it is implemented. So what kind of barriers were present, what facilitators were there, kind of what is people's experience of actually delivering this intervention. So we're really looking at the workings and the kind of the implementation and the processes behind it as well. So as part of that piece of work, we'll also be looking to local authorities to identify people who've been involved in that process to take part in interviews and possibly focus groups to give that more qualitative aspect of the process itself. I appreciate that's a whistle-stop tour of the evaluation, but I'm happy to answer questions on the sort of technical details of that in the Q&A. And that's it for me. I'm not sure if Ella's made it back.
I have, tentatively. I'm not super sure what happened there, but everything in the room I'm sitting in turned off. So that was excellent timing. I'll just talk you through super quickly our grant making process. So this is just the kind of steps you can see there. I won't linger, but the portal, so that Flexi grant that I mentioned, where you can submit those expressions of interest to take part in the project, will be open from the 15th of April, and you'll have around a month to submit your application. And that will be assessed by myself, colleagues at Centura, and our Grants and Evaluation Committee, who will have final sign-off on any decision. Super, we can go to the next slide, please, Kit. Thank you. So Flexi grant, we've talked a lot about it. What is it? Some of you might be familiar with it. And this is just the kind of portal that we're using to do our grant making. So we're determined to make this as simple as we can. So this is what it'll look like when you open the link. And then we are asking that you register, but we promise not to spam you with emails. So that will just be your kind of work email address, etc. And then you'll get that screen once you're successful with registering. And you should then be able to see this little intro spiel here, letting you know about the Test and Learn program. And you can see that start an application button in the corner. And then again, there'll be for each project. So for this project, for example, it'll say Test and Learn, data to prevent homelessness, and then it'll either say evaluation or service delivery for you to start your application. And then I just want to highlight some of the key documents that we've made available in the Flexi grant. So firstly, the subcontract agreement that you'll be asked to sign, as well as the head agreement between CHI and DLUC, which sets out some of the terms that we will have to follow. And there's also the information policy, as it's referred to in the contract. And finally, the service specification for this particular project will be available for you to kind of review and check what we're asking. It'll contain all the kind of key details that we know for the project, including like how many referrals we're looking for and how we anticipate the service will be set up, the things that we've talked through today. Great. And then if we go to the next slide, yeah, thank you. So you'll have instructions and guidance throughout, and we've also put together a kind of how-to guide on like what we're expecting and how to use Flexi grant, but it's pretty straightforward. And then if we thanks, there'll be 6 sections, and where it says project type there, it will say something like evaluation questions, and we'll be asking for your details and to confirm that you don't already have a service of this type in your area, and asking a couple of questions about kind of how and why you would expect to deliver this service, but nothing too taxing. And then once you've worked your way through that, you will have submitted your application and you'll receive a little confirmation that looks like that. Thank you. So just a quick recap, as you didn't get to hear my full spiel, you got it from Graham's dulcet Scottish tones instead, which I'm sure was much nicer. We'll be asking for expressions of interest to deliver this exciting new service, as well as bids to evaluate the new service. And we're looking for local authorities, specifically unitary councils, to work with us at the centre with Centura and the appointed evaluator on this project. And those key dates, the 15th of April, when the expression of interest applications will be open on Flexi grant. And we're expecting that setup phase to last July till November, with delivery beginning approximately in November and running until sort of January 2026. And I think it's back over to you now, Graham.
Thank you, Ella, and thank you everyone for the presentation. So we now got about 28 minutes to be precise, I guess, for a Q&A. So I'm going to stop sharing my screen once I figure out the right button. And thank you everyone for putting your questions in. Tom may or may not be delighted to know most of them so far seem to be towards the Xantura area of the business, but I will try and run through them and see what we have. So, Tom, what's the difference between this offer, I guess, compared to the other type of work that you're doing with local governments already?
Yeah, thanks, Graham. So I think, obviously, as I mentioned, we've established a platform and we've been working with a number of different other local authorities for a while. I think there's several key differences for this program. One is really around trying to establish a group of innovative councils to deliver this at scale, but also at pace, to establish the fact that this is something that not only can prevent homelessness, but it can be rolled out rapidly, potentially nationally, as in the future if required. I think the independent evaluation, which Abby detailed earlier, is really important to be evaluated from the very start all the way through the outcomes, with a clear counterfactual group being monitored to really showcase the benefits is going to be really powerful. And I think working with 5 councils spread geographically with different combinations of urban and rural will also really present a challenge and an opportunity to showcase the power that data and insight can deliver across these different areas. So I'd say those are probably the key differences.
Thank you. So as the Q&As are done, you might see them appear in the Q&A section. I'm going to mark them off now, and I will try group the questions together. Just a quick one, Ella. What's the deadline for applications?
The deadline, I can get the exact date shortly, but the application's open on the 15th of April, and you'll have about a month to submit, so kind of mid-May.
Yeah, thank you. I think it's going to be on our website. We're just up sorting out all the dates, and it'll be published on Tuesday when our full grant page is live as well. And we'll also update an FAQ with that in it. 2 questions around the data, Tom. So do you have a summary of the data sets you'll be looking to extract? And then there's also a question about, can it extract from existing platforms such as Inform?
Yeah, so we've got a relatively clear idea of the data that we want to use for this. So I think probably what we'll do is add that into the FAQs that go around, Graham, rather than me kind of list them out line by line. But as you would expect, it's there's going to be debt extracts, some housing extracts, and some from social care as well would be the key elements for this program. And in terms of extraction, we have extracted from the majority of commonly used systems within councils and within the public sector already. So we've got data pipelines built from things like Liquid Logic and Mosaic and NEC and Capita and various other systems as well. We also have good skills in terms of building new extracts from new systems that we come across. So we're relatively flexible in terms of where the data is held. I think there was another question which I might lump into this, which was around a council that's already started to build their own single view, but have not started to look at the unstructured data yet. So if you already have a single view or a golden record that you've got in a data lake or some other system, then we can extract that data and then use the infrastructure to bring in the unstructured data as well and match that together. So happy to work with, and we already work with clients who have that kind of setup as well.
Okay, thank you. Yeah, I think that was the ambition of lots of local authorities, and certainly from my background, was to have that golden record as you described it, or a golden thread through it all, certainly. Is there a standardized risk matrix? And kind of how is it produced? You maybe covered that a wee bit in your slide around the background work you've done, Tom.
That's right. Yeah. So we do have a very comprehensive risk framework that sits within the infrastructure. So we're extracting across structured and unstructured data about I think about 30,000 different low-level risks, which then extrapolate up into a risk framework, which we're using for the advanced analytics side. So yeah, that does form a kind of backdrop to the work that we're doing and the cohorts that we're building.
Yeah, and is that across multiple systems in terms of that data that can be extracted? I think were you saying that earlier on, is that like we work with the local authority to extract across multiple?
That's right. Yeah, those are multi-agency risk framework. Yeah.
Yeah. Excellent. Thank you. And then there's a question around whether there's quite a few questions to be fair around whether we would accept applications or expressions of interest from applications from sort of non-unitary or combined between unitary and districts.
Yeah, so it's a great question. So we do currently work with a couple of county councils where we are extracting data from the county and matching it with district data, create that single view across a two-tier authority. So it is possible. I guess the reason that we referenced in the slides that kind of unitaries were preferable were just in terms of the time frame and the complexity of the project. But equally, we would be really happy to accept applications from a county and district combined. I think my only point would be that in that instance for this pilot, it would probably need to be one district with the county council, because I don't think within the time frame we'd have the ability to extract from eight different districts. And even though technically we can do that, it's just about the ability to deliver within the project timeframes as well. But yes, absolutely happy to accept an application across the county district.
I think it's fair to say through the application process on Flex Grant, you've seen there, if you're considering doing that, if you can please have a lead local authority, and then you can put in the details of the partnership as well. Just so we want one application essentially in that case. A couple of questions around the evaluation process, Abby, to give Tom a wee break. So are we able to repeat the sample size, the date, and the value of the evaluation, when the evaluation process will begin, grant making process, as well as the date?
Sure. Yeah. So on the evaluation side, in terms of sample size, so across the 5 local authorities, because we've already got Barking and Dagenham, so we're looking for 4 more, but across the 5, we're looking for around 2,500 cases that would be identified by the predictive model. But of course, half of those won't actually receive the intervention. They will be the control group. And we're also working on the assumption that around 50% won't comply, meaning that 50% of those folks in the treatment group won't actually pick up the phone. So the number of phone calls that local authorities are actually making is probably around 150, not 300, as it looks like from the sort of referral number there. But in order to get the effect size that we're looking for the model to give us a pool of potential at-risk individuals, 2,500 of those. But yeah, that number seems huge, but in practice, with attrition and with non-compliance, in practice, it's much fewer people actually receiving the intervention. In terms of the evaluation, what was the other question? Sorry, Graham.
So it was when it was going to get published on FlexiGrant and the value, the approximate budget for the evaluation.
Sure. So Ella, can I
15th of April.
There you go. Sorry. Thanks, Ella.
No problem.
As a much more organised member amongst the two of us. Yeah, so evaluation spec will go up on FlexiGrant as well. So all the details on what we expect from the evaluation is there. But as I said, the evaluation and the intervention itself will be co-created between all parties and all partners, and that will be in kick-off meetings once we've appointed an evaluator. But yeah.
And we're anticipating the budget will be around £250,000 for the evaluation. And just when you're mentioning on that support element, Abby, there's a couple of questions around that in terms of, is it possible to, I think this is a support question, so apologies if I've got this wrong, but is it possible to customize the solutions depending on the requirements of the LA? And then there was a question also, is there an expectation of certain type of support offered once people are identified?
Sure. And I think this will come out once we've appointed the local authorities, because of course, different areas are going to have different types of needs. And so from an evaluation perspective, we will have to have rules around what the intervention looks like. And so we would need some kind of systematic rules around what type of support that we're giving. But essentially, it's pointing people towards potentially grants that they might be entitled to, other types of advice and support that they might be entitled to for the specific types of issues that are coming up. But they are going to be more finance related, because the ultimate outcomes that we're interested in measuring is around indebtedness, that may then lead to someone being at higher risk of homelessness. But definitely, and that's kind of a really key part of this working group, is that it needs to make sense to all parties involved. And although there'll be a framework, there is some flex within that. And we can also build into the evaluation scope for measuring differences between the interventions. So that might be kind of subsampling, because we know that there'll be variation, not only in terms of what might be demanded, but also, in fact, the types of support that might be available is going to differ across local authorities. So it's not going to necessarily be a completely transposable model, or the intervention isn't going to look exactly the same across local authorities because of the nature of the available support that is there existing.
And if I may, Sarah, I don't know if you've had any thoughts within LBBD about what that may look like. You may be slightly further ahead of that journey than some of the local authorities joining us today.
Honestly, no, we haven't got to that point yet. So we haven't started thinking about the service design. We're waiting, I guess, to have the other local authorities on board, and a sort of sense of exactly who we're surfacing, who we might be surfacing before we work on that. But we've done similar projects with Santura before, where we've identified cohorts who were in need and then wrap services around that. So we've done that particularly looking at people. We did a project last year looking at people who had debt to the council and mental health needs, and we wrapped certain services around them from our existing portfolio of services and offered those to people who were surfaced in that cohort in a proactive way. So I think we're imagining that it's going to work in a similar way. So building on our existing services that we already offer, but focusing more on how we're going to offer those proactively to the cohorts identified by the model.
Excellent, thank you. I think that's helpful just to understand, I guess, from another area that's already done some of this work with Santura, and also, I guess, reiterating Abby's point that we're waiting until we have all the elements in place to designing what the intervention will be. I've given Tom a wee break, but we're going to go back, Tom, with a few more questions coming your way. So we've got a question here. We're also working towards adding qualitative data on the journey from street to home. So would one view allow us to integrate that data with other data based on resident IDs? So
yeah, so that was what I was just briefly alluding to before. So if you're already making progress in terms of that kind of single view, then yes, it can be additive, and we can already take what you've already got and just bring in some of the wider unstructured data processing and advanced analytics on top of that. So yeah, that we could pair that up separately as well, if to understand more about what you've already done in that space.
And then will there be training on the OneView in order to design bespoke dashboards associated with specific interventions? So how will, I guess, in some ways that data come back across to the local authority teams?
Yeah, that's a really good question, actually, and one I should have covered off earlier. So it's the system is not a closed box, I guess is the point. There is a developer environment which enables councils to access all of that match data themselves, to access the models that we build, to access any dashboards that we've built, but also to build their own dashboards or evolve the model in the future themselves. So absolutely, and we would train you on how to access that and how to view the current models and dashboards as well. We're very much acting as, I guess, that data as a service platform, but ideally handing that match data repository back to you in the future to build your own models and build your own advanced analytics functions internally. So yeah, great question.
And then one more, I think that's more directed to you, that do you have thoughts on the type of data that you'd be needing, so we know what teams a local authority might need to get lined up? So, and what level of information, i.e. full access, basic details, or would it be extracted information?
Yeah, so it wouldn't be full detail. So the data that we would be extracting would be agreed through the DPIA process and through the information governance process, and then we would only extract the fields that we'd agreed in that process that could be used towards this agenda, where there was an appropriate legal gateway in place. And then the types of data would largely be debt, housing, and potentially data from some data from social care as well, to support with the identification of the cohort. But we can put more information around I guess a key starting suite of data in the FAQs that will follow this session.
Thank you. And then a couple of questions, Ella, that I'll head towards your way. So, how much time do suppliers have to put together a bid post-launch? And would we accept a bid from another North East London borough?
Great questions. So the FlexiGrant portal, which will open on the 15th of April for this project, you'll have about a month to submit your application. And I would encourage everybody who's interested to submit a bid, and it will go through our assessment process, and we'll let you know how you get on. But yeah, I think, does that cover the question?
Yep. And then would we accept an application from another North East London borough? Is that?
We are looking for a bit of a spread, kind of geographically, in terms of the places that we're looking to work with. But never say never, I guess.
Yeah, I think so. I'll try to maybe draw that out a wee bit. So when we're assessing the bids, we've also got to assess it against evaluation criteria. So what we need in terms of the evaluation. So there is a challenge for us that if we have, for example, 5 London boroughs and they all score the best, we're unlikely to actually award it to 5 London boroughs, because the evaluation wouldn't be as good as we could make it if we had it dispersed across different areas of England, or different types of authority in terms of rural, urban, metropolitan. So it could be multiple in one area. That could absolutely happen, but we need to ensure there's a spread to get the best possible evaluation. And the reason behind that is, again, so we can then amplify our learning from it. So when we're speaking to over the next couple of years, we want to be creating communities of practice around this and sharing our learning as we go along. And again, that's just in a London, 5 areas in London, that might not be as useful for example, a local authority in the west of England or the north of England. So that's why we're doing that way. Another question, Anna, is there any funding that could be applied to support the project, and can we elaborate on licensing arrangements and costs?
So it's a great question, and something that we talked about a lot internally. In terms of funding available to support delivery of the project, there isn't any funding specifically for councils to deliver. However, you are getting access to Centra's amazing OneView platform, and Tom and his team are incredibly kind and very knowledgeable about what they're doing. So that's a real, I think, benefit to kind of taking part in this project. The second part about licensing and things, so you won't have to pay for the OneView platform for the duration of the project. That cost is covered. And obviously, and so the cost of the license for the platform is covered.
Thank you. A couple of questions, Abby, towards the evaluation. So is there going to be an inclusion or exclusion criteria targeting of the intervention, or will that be developed through the working group?
Yeah, so again, unlike most other evaluations, the parameters of defining who are at-risk groups will be done in collaboration across the working group. So it's coming up with data that's going to be important in identifying risk, but also the thresholds above which we decide someone is high risk or at risk. So that is not sort of an ex ante, a beforehand arbitrary threshold that we're imposing. So that will be determined, sort of the parameters will be determined by the working group. And then ultimately the model does the inclusion exclusion. So based on the parameters that are decided upon and those rules fed into the model, and then the model essentially says these folks meet that criteria, they are determined at risk, they're included as part of the potential pool of people who are eligible for the study. So yeah, it won't be us imposing that inclusion exclusion, it'll be part of the project. Hope that makes sense.
Thank you. I've got 3 questions that are remaining, then we'll wrap up the webinar. So does the intervention have to be delivered to all at-risk groups, or if there are existing offers for some groups? So for example, young people at risk of homelessness, could the intervention focus on another group? So once we surface that group of people you're just talking about, Abby, does it have to be the same intervention for everybody?
And again, I think that's part of that same discussion. So if there are priority areas that can be agreed upon across all local authorities and all partners in the project, then it makes sense to target those interventions in that way. I think that has to be part of that conversation rather than kind of predetermined at this stage. But for sure, I think that's going to be part of the discussion. You know, what is actually business as usual? Are there groups that are getting a form of, let's say, intensive support, and how do we want to treat those in this project as well? So those are kind of conversations that will happen as part of the setup phase. Yeah, so I know it's not, I can't give you kind of direct answers, but I hope that kind of is encouraging in that you will be very much co-creating the intervention with the other partners to make it make sense to your local authority as well.
And then one more, Abby. Do you have permission to share your data for research already, or would that need to be built into our timelines?
Sure. So from an evaluator point of view, so because we are essentially working for DLUC, we will be arranging and helping evaluators in that process, but essentially evaluators will sign data sharing agreements with DLUC as data controllers. And I'm looking at Graham as our resident expert in data sharing and processing, but essentially evaluators have that agreement with DLUC, and DLUC have that agreement with both CHI and Xantura, and then data sharing agreements are between Xantura and the local authorities. So DLUC as that kind of central data controller facilitates the data sharing amongst the various partners. So yes, it will to some extent have to be built into the process, but it's not with individual delivery partners, it will be with DLUC.
And I think it's fair to say, as we're already working with some evaluation partners on other test and learn projects, like that work is underway. It's been underway, as I'm sure everyone can appreciate, working with data protection. It's been underway since the moment the project started, to be honest, because we need to get ahead of the game. Yeah, and that will then have to be individual agreements with all the local authorities and the like once we're there. I've got another question about if it would be helpful to know if another authority in London will be considered as part of the geographical spread. I think it's fair to say it could be. It will depend on the bids, but it wouldn't be all 5, as that's the example I was using. We wouldn't want to get into a situation like that because we couldn't spread the learning. And then one last question, Tom, it snuck in there at the end. Will the project only use data held by councils, or could it also combine and use data collected by an individual or cohort, e.g. a homelessness charity, NGO, or another not-for-profit?
Yeah, so the platform's agnostic to where the data comes from, and we've worked with voluntary organisations and charities and pulled data in from them in the past. So I think it will just be getting that balance between having too many data owners to get permission from and agree the IG with, versus the value of that data in terms of identifying people at risk of homelessness, and that'll be something which we'll work through over the next couple of months and once the working group's established. So there's no reason why it couldn't be. We'll just need to define it to optimize both of those things, time and benefit.
Excellent. Well, thank you, Tom. Thank you, Ella, Abby, and Sarah for your contributions. I want to bring this webinar to a close now. So thank you very much for taking your time out your day to hear more about the Test and Learn project using council data to prevent homelessness. I hope it's made you think about the role that you could play going forward once the expression of interests open on the 15th of April. And also consider starting those conversations now. I think we would encourage just with those executives in your organisation, as well as data protection officers, ICT departments, or whatever your name is for them in your particular local authority. I'm going to leave with a reminder, we have one remaining webinar that's on the 16th of April about the Outreach and Health Test and Learn programme. And you can go to our website to find out more about the other Test and Learn programmes. If there's any questions we've not answered today, send us an email at programs@homelessnessimpact.org, and Ella, Rebecca, our colleague, or myself will pick that up and be able to get back to you. But thank you very much for your time again, everyone, and hope you have a good rest of your Tuesday. Cheers now.
Thanks.
Thanks, everyone. Bye.